any resources in our community.
So Joy,
Don't have any resources in our community. So, and there were some other things. There's some other things, but those are things that are top of mind right now, because those are also some things that I've been working on. So then the other thing is looking at the needs that we're seeing that are coming up over and over. Then also what systems are out there that are already in place, and we've found at least 3. Andy can tell you that I'm pretty bad to bite off a lot more than somebody else can chew, but I'm trying to keep this manageable. So I have found at least 3 systems that through which I think we could work to begin to build the tool set for some of these leaders in faith communities that their words, not mine, we don't learn how to do this at preaching school. And that is things like the ASSIST suicide prevention training, talk training, and now we're also looking at how we can get a cohort of folks throughout the state trained in mental health first aid. They can provide some help until professional help gets there.
Right.
So one of the groups that we're working with, just begun to, is the VA Clergy Partnership. 6 community advisory boards around the state. They primarily serve veterans, but if you look at the high rates of successful suicides in the veterans community, they're going to be a timely group to work with.
Yes.
And then there's another group. I've got to turn around and look at my map just a minute.
And while you're doing that, is that VA Clergy Partnership nationwide, or is that just in Arkansas, as far as you know?
No, I don't know if it's nationwide, but I know it's at least multi-state. Because one of the person who is sort of the convener of the Clergy Partnership cabs works Arkansas, Oklahoma, and maybe Missouri.
Okay, thank you.
So Erica, maybe if you could Google them, and
I'm doing it right now.
See a link. Yeah, check that out. I had the same question.
Yeah.
And so there's another group that I've not yet reached out to, but I plan to, and they're called Dream Centers. And they have, I think, 9 places across the state and are shooting for 11. And now this is a group that comes out of a community of faith in Texas. They serve, their target audience is homeless people, people with mental health issues, and helping people establish themselves in the community after having gone through treatment or maybe incarceration. And then there are the rural hospitals associations. And Andy, you'll have to tell me, I don't remember what ACT stands for.
That's the Arkansas Community Transformation or something. It's their
transitions, because it has something to do with rural hospitals and transitioning care. And so a couple of those coalitions are looking to engage communities of faith to reduce readmission to the hospital.
Okay.
So that's kind of the focus right now, and we're building that process and trying to build a model as well.
Right. So what I love that you're sharing is you're sharing some very specific examples of this, I think, a promising strategy to engage faith partners, and that is looking at organizations and systems within your community that are already trying to engage faith partners. It may not be exactly on the same issue, or they might have a more tightly focused area, but guess what? Health connects to everything. So
Oh, absolutely.
right. So it's easy to kind of look at those systems. And so Andy shared with us some, three that she's reaching out to or working with, some of which may, even if they're not in your community, maybe have some model approaches for the kinds of trainings they provide or resources that they provide or outreach that they do. How about everyone else? Is anyone else taking a similar approach where they're connecting with some of these local kinds of systems and organizations to engage faith partners?
Well, in Jefferson County, there is I have a card right here. One of our big health systems has a clergy wellness program where they're reaching out to initially the pastor of churches and getting them connected to gym and nutritional workshops, and then the next phase is to help them establish a health ministry if they don't have one. If they already have one, ways to augment that
Wow.
health ministry. So we've been, this point of the phase for the hypertension project, we've been more of the needs assessment, but the next phase we definitely want to engage them and see how we can work together.
Mm-hmm.
And there also has been mental health first aid that was provided to some clergy in this area as well. That also was through St. Vincent. So there's been some good engagement through our health system partners.
That's great. And it sounds like this mental health first aid training, that might be something that each one of us looks at who in our community might be providing that. But it sounds like even across the two communities we've heard from, that they're really doing an intent focus on engaging faith partners.
Mm-hmm.
That might be a good inroads. Good. Thank you.
Yeah, this is Dave. In our efforts, or in our area, we're in the Charlotte metropolitan area, so we have three major health care systems, and two of them are non-profit, and one is a quasi-governmental structures, but they all are trying to do the community benefit as part of being a non-profit or a quasi-government. And so they had different ways to put resources into community outreach, and one of the systems actually hired a nurse to go around and make contacts with churches. And we thought we were really struck it rich with that, but then they restructured. And well, the nurse moved away. She had a family, a job opportunity. She moved away, so the position was vacant, and while she was vacant, now they're restructuring. So we're having to wait for that. But I really like what I hear about the mental health first aid, because one of the hospital systems has really gotten behind that, and that's something that we could really maybe attract some of our pastors and staff at different faith-based organizations to come to a meeting. And then we've got to get something that engages them. Now, there's one other thing I was going to mention. In Columbia, the University of South Carolina has a couple of different centers of academic studies, and one of them, they've been trying to do some surveying of churches and survey ministers or pastors or faith leaders, and then they have one survey, and then they have another survey for actual members of the church, the faith-based organizations. We don't have any money to do that. We were trying to see if we could be chosen as a county where they would come and do that, but we haven't gotten there yet. I don't know if anybody else has used surveys as a way to identify specific need from the faith-based organizations themselves, and then that's how you decide what you're going to offer to try to get them to the table. Has anybody done any surveying?
This is Joy. We two things. The College of Public Health does a lot of work in our Delta area with communities of faith, and specifically in African American communities. And it was through that they determined that, that they needed to reach out more than just in that particular area of the state. So they developed a set of focus group questions, Dave. That's how we found out more about the depression and the suicide and the substance abuse, like that. But then one more example, and I wonder if I can copy it and send it to somebody that can get it out to everybody. But Wesley Theological Seminary has a needs assessment tool for communities of faith, and it's an online tool. And I can certainly see if I can send that to y'all.
Well, Joy, what is the name of the organization again?
Wesley Theological Seminary.
Okay. Erica, if you could Google that, and if we can pull the link, we definitely want to include that on our resource list.
It's part of their health recertification course. But they might, I know that one of the things that we had to do was send that survey to our own ministers and have them fill it out. And it addresses several areas of needs and resources and things like that, to get an idea of where the resources are and where the gaps are. And Dave, I don't know if that would help give you some answers or not, but it was, I think it was pretty telling from some of the people who did the assignment.
Yeah. David, you can unmute yourself. I just muted you because I figured out what was happening. The reason why we're hearing feedback is because you don't have headphones and the sound was bouncing off of your wall at your house. But you can unmute yourself to respond if you need to, if you want to respond to Joy.
Yeah, I'd be very interested. I think
Trying to find it.
we had a graduate student, a public health graduate student, 2 years ago, who actually compiled a whole list of all the churches and faith-based organizations in our county. And so we still have that, and we are the Bible Belt as well, because we, in a county of 250,000 people, we had 330 church or faith-based organizations. So what I was getting at is that we do have some email contact information. So if there was a survey that was online, that we could email that out. That would be something we could afford to do. Yeah.
That'd be great.
I
haven't been able to find it, Joy. So if you can find it, that'd be great.
Yeah, I don't think it's going to be on their website because I think it's in course content. And but I will email my instructor and ask if this is something that could be passed along.
Thank you.
And Joy,
and who do I need to send it to that can get it out to everybody?
Joanne.
Yeah.
Yeah.
So Joy's not on chat. Joy,
Yeah.
I have your email. I'll go ahead and email you so you have my address and can send that to me. But I just want to make sure, because I have pulled up the Wesley Theological Seminary.
Uh-huh.
Is that the right?
It is, and it's called Health. It may be called Heal the Sick, but it's their Health Ministry Certification course.
Heal the Sick. I'm just going to at least send that general link.
Okay.
Right now. Great. Other ideas from folks about systems or organizations that might be good to think about, others to think about in terms of engaging faith partners?
Another one that I wanted to mention was we have a congregational health program at one of our area universities that works more with congregational nurses and it's like a networking place, and I think they have meetings quarterly. That's also a way to get information out here in Birmingham.
And what's the name? Is it a denomination that has that
No,
network?
it's supposed to be all of the different nominations.
Oh, okay.
Yeah, Stanford University, and it's their congregational health program. And there may be something similar at other universities.
Might be. Joy, one question I had for Joy was, Joy, you had mentioned, this is Erica, by the way, just in case you can't see me. You had mentioned that the needs assessment survey revealed that the churches just weren't prepared to deal with certain populations that, are suffering from addiction, et cetera. But because it was a survey, I'm not sure if you have a sense of whether or not they were actually willing to provide those services. I'm just curious. Is it a matter of just wanting to know more, or do they have some hesitancy about serving people?
Well, Erica, that's a really good question, and this was done through focus groups.
Okay, it was focus groups. Got it.
It was focus groups, and that is a really good question. And I am probably making a huge mistake by assuming that that they want to know more. But you know what? That's something I really need to go back to our colleagues at the College of Public Health and ask them, because at the time those focus groups were being done, I was Andy, don't laugh out loud at this, but I was being quiet and listening and trying to learn. And
Yeah, I didn't laugh. I'm sorry.
I knew you would.
Sounds like it's not something you typically do.
And we're so grateful that you don't, Joy. You're sharing great stuff.
I'm going to show y'all, since she can't see me, this is the hand signal we give her a lot of times.
Yeah, I've seen that hand signal, and I got one for her too.
I'm sorry, I can't see you.
But I think from the level of compassion, I think that I was evidently seeing. I think they want some information so that they can help.
Yes.
And so I don't think any of them were looking at trying to solve the problem or be the person, but I think they, by and large, would really want to know how to do the kinds of things that Assist and Safe Talk and Mental Health First Aid does, which is, to be that stopgap perhaps, or be able to pick up the invitations and the cues, and then have a resource list of either who they can call or where they can take someone for further help.
Yeah, I think what I'm hearing from this, and I know some, we've been talking a lot about the mental health training, first aid, and so that seems to be an issue that faith partners want to make sure, to their credit, that if they do start to reach out to their congregations about health topics, that they are spreading the right information, right? Or that they at least are connected to experts like Walk a Doc, so that they don't have to necessarily be trained on all of the health factor areas and issues. But that's a role that I think coalitions can play, right? Is giving them that resource list, or connecting them to folks who can do programs like what Linda's doing with Walk a Doc, or at least say, hey, if you need a presenter on this topic, nutrition, adverse childhood experiences, whatever it is, that then their congregation wants to hear, that you can quickly get those people and resources to them.
I think so. And of course, there's that ongoing dilemma that I know all of us have. As soon as you get a resource and you get it documented, I think Dave was mentioning this too, something changes and it's not there any longer, or it's not active, or it's something. But having a system, or a way to keep those things current for those folks, so that they don't feel frustrated once they've been given information and then go back and try to find it. It's not there.
Right.
Right. Mm-hmm.
That's been an issue here because we had an indigent hospital that lost funding, or the funding was put in another pot. So they have emergency services, but to get into their primary care, it could be up to 3 months. So it's getting folks to those other safety net providers, and we're finding that folks don't always know who they can send the uninsured to. So getting that message out more time efficiently, because things change and health centers open and then they close, and
Right.
that's been an issue.
Well, and Andy and I were just got back this week from a faith-based work group with NACHO. And, this was not something I thought about, even though I know it happens and I've seen it happen in some of the smaller communities where, they don't know what to do, but they know enough to know that perhaps someone who is having some mental health issues, or they are contemplating suicide. Sometimes the only thing they know to do is either A, call law enforcement, or B, take them to the emergency room. And in a lot of our communities, there is no local emergency room, no local hospital.
Right.
So law enforcement gets called, and, law enforcement knows how to do what they know how to do.
Mm-hmm.
So it's not just reaching out to communities of faith, but in some cases in a lot of cases, we're hoping that law enforcement can join our faith communities in getting this training.
Yeah.
Yeah, what you're describing just really speaks to the reality in some of these communities about these not having systems for prevention and support. And so the organizations that are sort of more the crisis management, like law enforcement and emergency rooms, are becoming the ones that respond to it.
Exactly.
Yeah.
We have United Way here in Vicksburg, and we do a lot of work through United Way, because United Way gets the foot in the door, because they have these agencies, and these agencies are faith-based communities, and they get their funding through United Way. So we have found that's a way to get agencies that are working together. Again, a lot of them are like Good Shepherd. They offer free medical, child care, GED programs. And so through United Way, the other agencies, like we have Grace Christian Counseling, they're able to go into Good Shepherd in order to take their services to Good Shepherd and talk about mental health with them. But through United Way, which is a big agency, it makes it more so that you're able to integrate all of this together. And it takes a champion, at United Way and at these agencies that began to blend it all together. And I have found that works.
That's great. I'm glad you mentioned United Way, Linda. And I know that, Monique, you have a partnership with your United Way as well.
Yes. We have a very, very big United Way that has over, I think, 50 agency partners that are connected to lots of crisis, a lot of mental health groups. And they've been a great resource. I also want to mention, we started working more with the fire department and EMTs and the folks that do transports. And we found that they're able also to do a little bit of crisis management in the field to de-escalate issues, so that you don't have to do that transport to the emergency room. And some education. And also, they're going to be partnering with our health center with some of our nurse practitioner residents to go out to the field to those folks that are high utilizers, that go to the emergency room over and over again, to do some additional education.
Monique, when you guys have reached out to, first responders like the fire department, emergency EMTs, what did that look like? Did you guys have meetings or did you have a training? How was that interaction?
Well, the person that's over that program at the fire department found out about our Health Action Partnership coalition and came to one of our meetings, and then he spoke up about what happens in the field, and then he's been able to get connected to different organizations through just interactions with that group. And it's been over a year now.
Yeah, it takes a while.
Right.
Great. So I know we've kind of, we're blending some of our conversations around engaging different kinds of partners, and kind of want to take us back to the topic of engaging faith partners in health. And I just really appreciate the sharing of so many resources about how to connect to systems, other folks, other organizations that can help with that outreach and engagement, making sure that as you're engaging faith partners, that you're giving them the support that they need to really kind of address health, or pointing them to the right resources. We actually, folks, I looked at the clock and I was amazed. We've got 8 minutes left. This has been great. This is exactly, this, you all have been our ideal learning exchange session where time flies by quickly. But I do want to kind of go round robin again and make sure that some of the areas that each of you said you wanted to tap into this group on, that we've addressed them. I just want to go round robin and see if folks have want to put any other discussion items out on the table. So let me actually start with Andy. Any questions for the group that we might be able to address in the remaining minutes?
I don't think I have any questions, but I did think of one more possible contact. I'm also over the Office of Rural Health and Primary Care, and they actually fund charitable clinics all around our state in Arkansas, and lots of those are come out of a church. And so that's actually an avenue that I really hadn't thought about until today. That would be a possible way to link to some of those churches who are already doing ministry in health and having these clinics. So that's just another possibility.
That's great. Good resource. We'll try to capture that. Let's go to Linda. Any final comments or questions for the group?
Well, I was very interested in, I think it was mental health first aid. I'm not sure I found that to be very interesting, because I think, as we all know, a lot of this is behavior, and it's a way of sort of getting to the root of the problem. But I think I came in just as it was starting. I'd like to know a little bit about what's mental health first aid in a faith-based organization.
Mm-hmm.
Joy, could you answer that for us?
I'll do my best. And Linda, I will refer you to, there is a link, a website where you can look at the course content.
Okay.
And I know that there will be a training, I think, in October in Jackson, Mississippi. It's not cheap. It's a 5 or 6 day training. It's a commitment. Then you become a trainer, and it's about $2,000 to do that. Anyway, I need to find that link, because I looked at the course content and things like that, and it's intense. It's intense, but you learn, and then you learn to teach people how to be the 911, if you will, for people that are suffering from various forms of mental illness or prevention of.
And it looks like, Erica, you may have found that link and chatted it out. So we'll make sure that gets on the resource list as well.
You can also look on that link and find out if there are people already trained in your area.
Good.
Wonderful. Monique, any final comments or questions for the group? That we've got about 5 minutes here.
No, I just want to say thank you for hosting this opportunity. This is new, the face.
Yeah, this is great.
Yes, it is. But just hearing whatever folks are doing, and also looking at my notes, it kind of helped me, frame things a little better. So just want to say thank you.
Good. And see, I think David and Joy, any final comments for the group before we move to next steps?
My question was next steps. Will we be able to do this again?
Okay, we'll get to that. How about David?
Yeah, I wanted to ask, we don't have a paid, sounds like all of you have, either it's part of your job description or you have access to somebody who's paid to do this work, to reach out to faith-based organizations. We're just all volunteer until we can get this link back with the healthcare system, area healthcare system. So, I mean, do you have any comments about that? I mean, does this seems like it takes, like I volunteer and I've been working on this, but I just kind of work on it with a couple other people when we have time. It sounds like if you have somebody who's paying attention to it, week in and week out, that would make a big difference. What do you think?
Dave, this is Joy. I think that you're absolutely right. But some things I found out since I took this position is there's a counterpart for me at our Department of Human Services. So you might check that out in your state. And then also because of actions that were taken by the federal government a number of years ago, there's like a national office of faith partnerships in public health. And so while ours is not functional in Arkansas, our governor does have someone who is appointed by his office to address communities of faith partnerships. And so I found all of that out just by Googling, keywords like that kind of thing. But the DHS has turned out to be an incredible partner for us in our faith partnership work.
Great. Thank you for that. And again, thanks to this group. We do have a few more things we want to share out before we talk about next steps. So this is one that came across. I'm based in North Carolina, and the North Carolina State University has supported a Faithful Families Eating Smart and Moving More curriculum that has been in existence for years. But it's really for training for people who want to implement that program in their state. So you can go to the link you see here to find out more. They want to try to implement Faithful Families in other states. And you're all in the South, so fairly close by. But if you have any partners who you think are ready to implement a curriculum, this is one that, like I said, has been actually tested over the years and in a very southern state.
Mm-hmm.
And
so does the USDA Extension Service has a good one too.
Yeah, this is actually part of the Extension Service in North Carolina.
Great. Yes, it is really good.
And then, Erica, this is something that was shared by one of your partners. Do you want to, Monique probably knows, from Greg in Birmingham. Do you want to talk a little bit about this?
I'm going to let Monique, this is an example of a health and wellness ministry that he shared. But Monique, do you know a little bit about it?
A little bit.
He really wanted to share the logic model.
Okay.
And this is, so Greg is a member of the 16th Street Baptist Church. So I had shown, this is the website and we can chat that out.
Mm-hmm.
But Greg wanted to specifically mention that they have a health and wellness ministry that really has a leadership role in educating the church family on diet, disease, and the development of a healthy lifestyle. And there's a summary about their health and wellness ministry if you go and visit the church's website. But they actually created a logic model for their health ministry, which can be incredibly helpful to ensure that, folks are staying on course and staying on path with, that you're not just doing one-shot programs here and there, but that there's this longer-term kind of strategy for health ministry.
And I can tell you, Greg led this effort, And they have also partnered with a lot of university partners as well to help with A1C and hypertension, and have been able to do a lot of programs that have robust evaluation as well.
Oh, great. The
Awesome.
evaluation piece is great if you're trying to secure funding too for sustainable programs. Great. All right, folks. So again, thank you so much for this rich discussion and for your high engagement and participation. We are going to ask that before you disconnect today, please use the chat function. Joy, you can definitely email me back once I send you an email. But what we really, really need from you is to give us your feedback on these questions. Let us know, are you interested in continuing this type of collaborative exchange about faith partnerships? If so, please let us know what kind of subtopics you'd like to set the stage for another conversation. We are here to provide the venue for community partners to connect, but like I said, community partners really have to bring the content and the dialogue, which you did today. But let us know if you want to continue the conversation on this topic, and if so, what subtopics. Tell us what worked today, and let us know what we could improve for future learning exchange sessions. I should have mentioned at the top that we really are pilot testing these kind of video conference platforms to connect community partners across the country for this type of learning. And so your feedback is going to be really helpful so that we can go back to our leadership and say, yes, this is something that communities want. So please take a few minutes to chat in your feedback, and we will keep the platform open a few minutes after we close so we can get your input. Also want to let you know we will be sending a feedback survey via email tomorrow, and we encourage you to complete that feedback survey as well, again, so that we can continue to inform development of future sessions like this. Also want to let you know that, the CHR&R folks do a series of national webinars. The next one is scheduled next Tuesday, the 23rd at 3 p.m. Eastern, and it's going to be about the collective impact model and how that has been implemented in the real world. So they actually have a community partnership in New Jersey who's going to talk about how they've utilized collective impact, and Erica's chatting out the registration link for that national webinar now. All right, so we look forward to hearing your feedback and whether you're interested in continuing the conversation, and also to let you know that we will be hosting these kinds of focused discussion groups following every national webinar every month. So you can definitely be on the lookout on different topics to engage in this way with other community members.
Yeah, so thanks. Make sure that, thank you, Joanne, and make sure you do respond to those questions. I just want to thank David for planting the seed for this particular learning exchange. And, if you guys are interested in continuing to meet, we will definitely find a way to make that happen. Thank you so much for your engaged conversation. I appreciate it.
Thank you, everyone, and don't forget to give us your feedback.
Yep, we'll leave the chat open for a few minutes so you can respond. So feel free to do that.
Thanks.
Have a great day.
Bye-bye. Just to let you know, I'm sorry, I saw David's chat. We will be sending out the chats to everyone. So you will get that information. Don't worry about trying to write it all down or save it. Joanna, make sure you get it.